a group of final-year nursing students will be staging a protest in Leratong today. They're asking for more placements in Gauteng Health. The students say they had a series of meetings with the department who said that their contracts would be renewed. Meanwhile, one of South Africa's largest private healthcare facilities, Netcare, has expressed its concern over this critical shortage of nurses that's taking place, particularly in Gauteng. Let's discuss this further. We're joined this morning by the Gauteng Chairperson of Nursing Union. It's called the Allied Workers Indaba Trade Union. Bafana Tshabalala joins us via our video link this morning. We're also hoping to be joined by a nursing student leader in just a moment. But Bafana, good morning. Let's begin the conversation with you. Nurses so critical to any healthcare system. There's a saying that goes, that nurses are with us at our worst moments in life and at our best moments in life. And yet that importance is not reflected in how they are treated.
Good morning and good morning to your viewers. In health, we often say nurses are the backbone of the health system, meaning nurses are what holds the health system to be what it is. However, it is not reflective now, one, in numbers, because we have a gross shortage of nurses, and two, now that what the department is doing, they have trained students, they have funded them, they have gave them bursaries for 3 years. Now that they've completed, the department says they don't have money to appoint these students as professionals into the system.
What an incredible loss, right? After all of that investment, as you say, to now say that there are no placements because of a lack of budget. Is that true, Bafana? Is it true that there is no money to pay these new nurses?
It's not true, because one, when you offer someone a bursary, you should have a plan with what will happen to them after they've completed the training. So the department 3 to 4 years ago had a plan, had the budget, and hence they gave the students funding. And now that they've completed, the department is saying they don't have budget. They've written out the communication that says they don't have a 77 million to fund.
Lerato, can you hear me?
But when you count then the money that is required, it's no less than 8 million. So we wonder, how did they get to 77 million?
Yeah, Bafana, sorry about that. We're trying to connect with Lerato Rantsu, who is a nursing student leader as well. Lerato, if you're there, can you hear me?
Hello.
Lerato, you're live on the AM report this morning, and we want to welcome you to the program as a leader in the sector, as a nursing student. What's your experience of, having gone through all of the training to become a nurse and the treatment you've received from Gauteng Health so far?
Thank you for the platform. Firstly, my name is Mpho, not Lerato. Well, it's been very unfortunate that we had to experience this, because upon the commencement of the course, we were promised a lot of things, and now the department is singing a different tune and no one is willing to hear us out. Hence, we've resorted to other measures, such as involving the media platform and also participating in picket strikes.
Yeah. Do you want to give me your full name, Mpho, and give us your position?
My name is Mpho Rantsu. I'm third-year student that's completing on the end of May 2023.
Sure. So by the end of this month, you would have completed your training. What's being told to you and others in your position about why placement is now a problem?
Apparently, the department does not have a budget to retain us before the professional entrance exam. And this was not what we were told at the beginning of the course. And they've also come up with a figure of 77 million, which we don't know where it arises from.
Bafana, let's bring you back into the conversation. What does this mean? What does it translate into on the ground, this shortage of nurses at hospitals?
This goes back to what the High Court in Pretoria said in our case, SSS Court, to say government officials should not hinder upon people's basic right to health, because if we are saying we are not going to appoint more nurses into the system, meaning we are exacerbating the problem of the gross shortage that we currently have, we are actually meaning that we are not prepared to render a quality service to our people. And with that said, it means then we are failing our people when we fail to give them what is due to them and what is enshrined in the Constitution.
Yeah, I would take a step further, Bafana, and ask whether it results in a loss of life, the fact that we are so limited in the number of nursing staff we have in the country.
It definitely does. I mean, let us paint a scenario wherein you have 10 patients, for example, as Bafana alone, and one is critical and the other one is dying, and the other one is also needing your support. You need then to choose who are you saving and who are you letting die. So I keep on saying this government wants to make healthcare professionals accomplices to matter of this system.
Wow. When we talk about the shortage of nurses, Bafana, you know, if we lived in an ideal world, how many more nurses would we need? And perhaps that's a question that is particular to Gauteng.
There was a report that I read which said with the current role of nurses in the South African Nursing Council, we would still not meet the shortage that we have. We would still not meet the number of nurses that we need, meaning we have a gross shortage even in training. Because nursing education for the past 3 years was affected. We couldn't produce students because we were migrating from Department of Health to higher education. So we really need more nurses into the system. We really need the department to employ every nurse that is available, because if Netcare, a private sector, is failing to close the gap, it tells you how severe the situation is.
Mpho, you've said in other coverage in the media that you feel misled as this group of students who started off their careers in 2020. All kinds of promises were made to you then. Given what's unfolded now, what are your next steps?
So currently the students are at Bonale Sedi campus, which is one of the campuses of Gauteng College of Nursing. And then they are busy with the shutdown there, hopefully hoping for the management to come forth and give us the answers that we need. And then if that does not happen, then we have to take things a little bit further, which we'll discuss amongst ourselves together with our union. Then we'll take it from there.
Yeah. Obviously, this is an issue that is not only about your placement, it's also about your income, Mpho. After having worked hard for 3 years, it was something that you would have been looking forward to actually be placed.
Yes. So during these 6 months while we're waiting for professional entrance exam in November, we'll have no source of income or whatsoever. However, we are expected to pay for ourselves the 800 fee that is required to register for the professional entrance exam. So now we are questioning the department on where are we supposed to get that fee if we are unemployed.
It's a devastating story. Let me thank both of our guests for coming on this morning. Bafana Tshabalala is joining us. He speaks on behalf of HETU. He's the Gauteng Provincial Chairperson, and Mpho Rantsu is a nursing student leader. The department, for its part, saying that it doesn't have the budget to extend the current bursary period. We're tracking this story for you.